District 39 in far southwest Kansas, 11 counties, former county commissioner and community college trustee, married for 42 years. I have 6 kids. My wife has 7, I like to say. And I'm pleasure to be on this committee.
And the ranking minority leader this year is Senator Cindy Holscher. Cindy, would you like to introduce yourself?
Thank you, Chair Gossage. Pleased to be here. I've served on Healthcare Committee the past 4 years in the Senate and in the House prior to that. So great to see some new members and some Johnson Countyans as well as others from across the state. So thank you.
And then just a moment for some of our newbies to the committee. So we'll start right over here with Senator Murphy.
Thank you. Yes, Senate District 34, which is South Central Kansas, three districts, 3 counties, and happy to be here. Retired captain with United Airlines.
And since I believe we'll have time today, let's just go right around and introduce ourselves.
Moving this around. Senator Pat Petty, 6th District. It's in Wyandotte County and a small portion of Johnson County. And I'm starting my 13th year in the Senate. And I've been on public health and welfare for actually all of my time in the legislature.
Good morning, everyone. Stephen Owens. I come to you from the Kansas House of Representatives, where I served the last 3 terms, 6 years over in the House. I am from the 31st Senate District, so Harvey County, Newton, Heston. Heston's where I reside. That includes all of Harvey County and northern Sedgwick County. So excited to be here and begin year number 7 in the Senate. Thank you.
Renee Erickson, Senate District 30, which is Sedgwick County, East Wichita, Derby, and Mulvane. I'm happy to turn the reins over to Senator Clifford's 7th child, as I was previously the vice chair of this committee, was house trained with Senator Owens, and I look forward to serving with you, Madam Chair, in this committee. Thank you.
Then we'll go over to Senator Thomas.
Yes, thank you, Madam Chair. Adam Thomas, Senate District 23, which is a good chunk of Olathe and all of Spring Hill, a little bit of Johnson County, a little bit of Miami County. Served 6 years in the House as well, came up with Representative Owens and Senator Erickson. It's an honor to be back in this beautiful state capitol. I look forward to serving with all of you. Thank you very much, Madam Chair.
Thank you, Madam Chair. My name is TJ Rose, District 35 in Johnson County, to the east of Senator Thomas, and this is my first year serving the Senate.
Chase Blasey, representing Senate District 26, which is more or less the western half of Sedgwick County, so parts of Wichita and then a lot of smaller communities, Goddard, and many others to the west of that. I'm east of Senator Murphy and south of Senator Owens, and this is my 3rd year in the Senate, and I think I've been on health every year I've been in the Senate.
And neglected to mention Majority Leader of the Senate.
And thank you, Madam Chair. Senator Mike Thompson, 10th District. This will be my 6th session on the Health Committee, and serve Northwest Johnson County, mainly Shawnee, Lake Quivira, Lennox, a tiny bit of Olathe. And once again, it's a privilege to be back. Thank you, Madam Chair.
Thank you, committee. And now let's introduce our staff, and we'll start with Suzanne.
I'm Suzanne Nelson, and this is my 13th year with the Senate as a committee's assistant. I served with Senator Jeff King for 4 years in Judiciary, Senator Jeff Longbine for the last 8 years, and now I'm privileged to be with Senator Gossage.
Good morning. My name is Jenna Moyer. This will be my 10th session in the legislature and probably 5th or 6th on health committees.
Good morning. My name is Carly Choi. This is my 4th session and my 2nd as a health revisor.
Elizabeth Cohn, with Kansas Legislative Research. This will be my 3rd session.
Ida Orr, also with the Kansas Legislative Research Department. This will be my 16th session, and I've been on either Senate Health or House Health or both each session.
Thank you. And just a couple of things. We are going to begin, as we will most of the session, with requests for bill introductions. Do we have any bill introductions this morning? Seeing none, we'll move then next to discussing the rules. And committee, Suzanne, would you explain how they can find it? Typically, we go to the committee, and one thing I should say, Suzanne served for years under Jeff Longbine in FI&I. I served on that committee and had to carry around big, huge folders of paper. This is a paperless committee, so she's learning how to put all of these on here and tell us how to find it. Sue, could you tell the committee how to find their rules today?
There we go. The senators and the representatives have access to the S drive. And this is where I store the documents prior to uploading them to the committee webpage. We can only divulge the documents 2 hours prior to our committee meeting. And I always try to get those uploaded just as quickly as possible. But on the S drive, you would go to the little, looks like a manila folder at the bottom of in your tray, open that folder, and then you will go to committees, and then Senate committees, and then inside that it would be, well, I think in there they're standing also, but then go to Public Health and Welfare. And when you open up that there will be a 2025 folder. You open that, and then there will be a folder for each date we have a meeting, and that's where the testimony will be, besides being uploaded on the committee webpage.
Committee, are there any questions regarding the rules? Seeing none, all in favor of adopting these rules for this year, say aye.
Aye.
Opposed? The rules have been adopted. Thank you, committee. And now we'll move on to our testimony today. And because we were having some difficulty initially getting this report to you, it's the first time and only time you'll have paper. So this is for the report of the Special Committee on Targeted Case Management. And then I will ask it would be with the Kansas Legislative Research Department, and who will be coming forward? Elizabeth, there you go. Please introduce yourself to the committee, and welcome.
Good morning. My name is Dayton Lemunyan. I'm a senior fiscal analyst with Legislative Research, and I served as the facilitator for the Special Committee on Targeted Case Management. Background before I get into the recommendations: Targeted Case Management is a Medicaid state plan service that helps coordinate services for individuals with intellectual developmental disabilities. So the genesis of this and a lot of the recommendations will revolve around a plan to separate the case management services from the actual provision of services. KDAD's indicated during testimony at the committee that they received instruction from CMS, which is the federal licensing body for Medicaid, that they must separate those two services. So I'll jump right into the recommendations on page 3. The Special Committee on Targeted Case Management recommends the Kansas Department for Aging and Disability Services distribute a survey to individuals on the waiver, to individuals on the wait list, and to other stakeholders. Findings should be reported to members by December 15th, 2024. The survey should ask the following questions. Are you satisfied with the services received from your community developmental disability organization and targeted case management provider? Are you aware that you can change TCM provider? What feedback, if any, would you give to KDADs regarding your services? The next recommendation: KDAD should develop a Kansas-specific response to meet requirements by the Centers for Medicare and Medicaid Services to prevent conflicts of interest in providing TCM, including allowing agency-based and independent case managers indefinitely, allowing all flexibilities, including a clear firewall for agency-based providers, and building a robust monitoring system, including allowing exemptions in rural areas. And then the final recommendation, the House and Senate Health Standing Committees should review TCM provider capacity and reimbursement rates during the 2025 session. Finally, the committee approved writing a letter to CMS requesting written documentation of the conflict of interest provisions and guidance from CMS regarding the need to separate case management providers and service providers, as well as whether CMS is aware of rules already in place in Kansas to prevent conflicts of interest. So those are the recommendations. Just a general overview of what the committee did. They received testimony from an international or a national organization for developmental disability state agencies, essentially. They received testimony from KDADS on what they've done or what their plan is, and they also received testimony from the public. And I'm happy to stand for questions.
Would you explain, I serve on that committee, of course, so for the rest of the members of the committee who weren't there or didn't serve on the committee, some of the concerns of the public that came in?
Sure. So members of the public, and if you turn to page 4, you'll see kind of a more a description of what the committee heard. There's a section for public testimony from individuals and families, and generally they expressed that they had positive experiences with their TCM providers and a desire for the current system to remain in place. So that was the general sentiment of that public testimony.
Committee, do we have questions for Dayton today? Yes. I'm sorry. Yes. Who?
I'll yield to the majority leader.
All right. Senator Blasey.
Thank you, Madam Chair. Do we know, has KDADS distributed a survey to individuals on the waiver?
Madam Chair, Senator, I have not received any information about the survey being distributed or results. I know they did send supplemental information to you all, which I believe you'll have a presentation on later this week.
Senator Blasey, if I may, we will have the KDAD's response on Thursday.
Perfect, thank you.
Senator Clifford.
Thank you, Madam Chair. Question of follow-up. I was on social service budget, as you know, 3 years, and I was always concerned that there was a conflict of interest with CDDOs providing services. But just from a business model, was there any pushback because they're counting on their service income to provide the other half of their service, the analysis or TCM part?
Madam Chair, Senator, so the next section of public testimony, it was divided between individuals and providers. So providers and stakeholders did present, and it was the general sentiment of the providers that they wished for the system to remain in place. I don't recall specifics about the monetary portion of it, but that was their sentiment, that they wished for the system to remain.
Follow up, Madam Chair. And I don't think CMS is okay with that, though. I mean, they need to firewall it in order to continue as usual.
Madam Chair, Senator, I think that was a discussion point during the meeting. There had not been written documentation from CMS to KDADS at the time of the meeting. So I think KDADS will have more to say about that on Thursday, and I'd kind of defer to them.
Thank you, Madam Chair.
Committee, other questions? Yes, Senator Petty.
Thank you, Madam Chair, and maybe this will come from KDAD. So has that letter been sent to CMS that was mentioned in the recommendations?
Madam Chair and Senator, the revisers drafted that letter. It is drafted but not been sent yet, as far as it may not have, we're not sure if it's been sent yet, but.
Committee, other questions? Seeing none, thank you so much, Dayton, for coming before the committee today. Committee, this is all we had for you today. We'll have a full committee meeting on Thursday. Thank you so much. And just for those who are new, Those of you who know, I look at my phone, and when it ticks over to 8:30, the meeting starts, so I appreciate you all being prompt. Thank you so much, and thank you to those who were here in the meeting room today. Meeting is dismissed.